campaign through our Neighbors for Neighbors program. In this program, we would recruit people that are currently using Brother Bill's clinical services. You can see here that we've made pamphlets to recruit people that are already using the services in both English and Spanish. We would educate them about the services that Brother Bill's currently offers, and then incentivize them to refer their friends, family members, and neighbors that are uninsured, so that they can also come to the clinic and try out Brother Bill's services. And for each referral that they get, they could get a free lab test, or if they have not shown up in the past at the clinic, they could receive a forgiveness for that. We believe that by going out to the community face-to-face, we can make a sizable impact on a very personal level with these clinical services.
So Brother Bill's is a beacon of hope for the West Dallas community. And by using our docs approach, we appeal to things like demand, outreach, collaboration with other organizations within West Dallas, and service expansion. And as an organization, we've only seen the tip of the iceberg as far as the amount of impact that we can make in this community.
Great. So we'll now have 10 minutes of questions from our judges.
I have one question. I have a couple of questions. One is, did you, in the idea about opening, being there in the evening time, and what did y'all, you talked about the reason, really one of the main reasons why we're not, is because from a safety factor. Did y'all consider that in any of your?
To be honest with you, we didn't consider safety as a major factor in us using this proposal. That's definitely a real concern, and it would be something to think about. We were more so focused on the amount of people that you could bring into the clinic. So, you know, when working with that solution, that would be something to think about as far as safety. And, you know, accounting to safety and, you know, attending to that need, you know, maybe a security guard or someone like that, you could bring in, you know, so many different more patients just from those extended hours. So that would definitely be something to consider with this great solution.
And the other thing is just as a comment on our clinic income, that 72,000 was the number that you got from what we get from Methodist with their district funding. That's what that amounts to. So, is it? I mean, that's not income. That the income from our patients is more like less than $10,000 in a year, and whereas this money is funding that is coming from Medicare, Medicaid money that goes through Methodist.
We're proposing using more the discrepancy between what you budgeted and what you had left over, and using that to invest in the later hours. So not necessarily the clinical income that comes from Methodist, but the discrepancy between the budget and the expenditure.
So you're proposing a direct competition model with Los Barrios, Parkland, and as opposed to a complementary services model. And I'm wondering what kind of evidence you have that the market in the community would be able to manage that kind of direct competition. In other words, of the 27,000 plus people who live in West Dallas, what percentage are not getting medical services at all? And I mean, just curious as to whether you know that.
Well, Brother Bill's is currently serving 960 patients. Los Barrios Unidos,
So Los Barrios Unidos serves insured and uninsured, and we're only collaborating with their uninsured. In regards to Thrive and Lake West, we aren't competing with them because Brother Bills, we do not serve the uninsured and Thrive and Lake West do. They provide 70,000 patient visits.
Those
And only
patient visits.
66% of those are. Can you please remind me of the question about?
Well, the community is about 27,000 people, 24,000. So I'm just,
That's the same
Rose
question.
also pulls, these numbers include their other location sites, which are outside of the West Dallas community. They have a Grand Prairie location and another Dallas location.
Los Barrios.
Yes.
And these are, that's all of the Los
Yes,
Barrios,
it's their
not just-
total.
yeah. But I think that I have the exact same question, I'm so glad you were more articulate. So, but, you know, looking at how many in that neighborhood of 24,000 have no insurance as the market size, do you have a sense of how many people that is, how many households that is? And, you know, if the demand is there, you know, to expand hours, will they come? Or is it basically a well-served community as it stands today?
We were not able to find numbers on a total amount that have insurance or do not have insurance.
But we do know that there's a good portion of the population that's not receiving any medical care because either they can't access it or they think it's going too expensive, they don't have the money, or transportation issues. It's all during 8:30 to 4:30 and they have 9 to 5 jobs, they can't do that. And so a lot of people just are refusing to get help, not refusing to get health care, but they aren't getting health care.
And that's why expanding our hours will be very beneficial because currently our hours are approximately the same as those doctors' needs.
So I imagine that at the end of this, you guys would have proposed that we hit the goal of doubling on size. And so how would you break down which of the initiatives you talk about have the biggest impact? And how did you think through what the drivers are?
Well, we think mostly the biggest impact is going to come from the expanded clinical hours because as Tyrell said, that's 1,500 more patient visits in a year. And we're assuming that not all those are going to be duplicated patients. And then I think that will have the biggest impact.
And keep in mind that a lot of our solutions are based on personal narratives. So most of our team had a chance to visit Brother Bill's multiple times and, you know, ask Suzanne and some of the community members, you know, where the needs are and what their needs are as community members and why they utilize certain services over others. So when we talk about going out into the community and visiting barbershops and things like that, we're appealing directly to the, you know, potential neighbors who do need clinical services but don't have the time or, you know, just other resources to, you know, get the clinical services. You know, expanding the hours, again, we're appealing directly to the needs of the community members. We see, you know, many men, you know, are working construction jobs or jobs that don't allow them to visit the clinic as they should. And women as well. We're dealing with a working class community. So by expanding clinical hours, you know, we're bypassing those workday experiences and things like that. So hopefully, you know, break down some of the excuses not to go to clinics.
A little bit for our audience, any questions?
Did y'all not think about extending the hours in the morning before work for people, also with the safety issue? So morning hours, could that be earlier than 8:30?
Extending to morning hours?
Yeah, because you said like the night hours would be like a safety issue.
Mm-hmm.
What about like people before work, like 7?
I mean, exactly. I mean, things like that. That's a great idea. I mean, you know, the idea is to extend the hours to meet the community where they are. So, you know, in whatever way that we can to, you know, best appeal to safety issues and the needs of the community, that would be a great way to, you know, look at it both ways. Maybe you should be on our team.
Also, if we could extend, you know, 2 hours, we're proposing 4 hours extra added to Tuesday, Thursdays. You do 2 hours more in the morning, 2 hours later in the evenings. It's still in daylight time where it's, you know, the safety is not going to be as huge of an issue as if we go to 9 p.m. So that's also an option to consider.
Yes.
Yeah, another quick question. Is language an issue at all? Like, it's, I'm assuming that everyone speaks Spanish at Los Barrios, but like, helping
open hands facility, is that like, can you get bilingual support and?
Oh, definitely. From us visiting, you know, Brother Bill, especially on Super Saturdays, they open up with the daily devotional. And that's in 2 different languages. So we get the scripture in one language and the scripture again in another language. So Brother Bill's already has accommodations for appealing to, you know, those demographics in that way. Yeah, so even with the pamphlets and, you know, just the backbone of the presentation and everything, we appeal to things like that to get over that language barrier.
Great. Any other questions? Good. I want to thank Team Red, Brother Bill.